Dr. Hochhaus, thank you for joining us on MD
Pleasure.
Newsline. It's a pleasure having you. You did some great presentations here at EHA. Please, for those that don't know, please introduce yourself to our audience.
Yeah, my name is Andreas Hochhaus. I'm professor for internal medicine, hematology, and oncology at the Comprehensive Cancer Center, Central Germany in Jena. And I have been involved in CML trials now for 30 years. I think that means I started with interferon, with imatinib, with the second generation drugs, and now with the new drugs which we present here.
Yes, and this is a long time, so I'm sure you've seen this field change quite a bit. Tell me a little bit about what you presented, but really, first of all, I would like to know um, how the field has evolved over time and how our understanding of the need for some of the treatments that you discussed at the conference, how has that evolved over time?
I think that's a very, very important question because some people claim that CML has been resolved. That means all the questions have been resolved, which is not the case. When we ask our patients, how do you feel on your treatment? Most patients say we have side effects, our quality of life is impaired, and we have daily problems. And of course, that's an important aspect for compliance, the tolerability of the drugs. Therefore, I think to improve tolerability is an important issue. But we see also resistances to the treatment. We have early after the introduction of imatinib 25 years ago, we have seen mutations, BCR-ABL mutations, which caused resistance, but we had nothing else available at that time. Then came the second generation inhibitors, nilotinib, dasatinib, bosutinib, which rescued some patients with these mutations, and also the third generation inhibitor, ponatinib, of course. But they are multi-kinase inhibitors, and multi-kinase inhibition means there is off-target inhibition, and this off-target inhibition may cause side effects, very specific side effects. For nilotinib and ponatinib, it's a cardiovascular side effect. For nilotinib, also hepatotoxicity. For dasatinib, the pleural effusions. And also imatinib has side effects. On the long term, the renal insufficiency and some gastrointestinal problems, the muscle cramps, and also the edema with imatinib are a problem. These problems have not been recognized 25 years ago when we had only one drug available. But now, having more choices available, it's very important, and our key factor in the choice of the treatment to improve the tolerability of these drugs. And that's, I think, the main issue. And we can improve the tolerability on a daily basis, but also on the long term when we enlarge the cohort of patients which is eligible for treatment-free remission. These are, I think, the main aspects for improvement of CML management.